I have good news from the New York Times, dated July 3rd, 2020, the same day as President Trump's Mount Rushmore speech. U.S. coronavirus cases. Deaths are still down. This story is by Catherine Wu, and for some reason makes absolutely no mention of President Trump and his handling of the coronavirus crisis. Apparently, when you want to blame President Trump for any initial problems or setbacks, he is personally to blame. But when there is good news about a decline in the mortality rate, President Trump's name does not come up once in this lengthy news story. This story, which doesn't mention President Trump at all, relates the facts from the New York Times, the paper of record. The virus appears to be killing fewer of the people it infects. The death rate is less than 5%. Experts cite testing, treatment, and a shift in whom the virus is infecting. Gee, just like President Trump promised to focus on testing and treatment. Diagnostic testing for the coronavirus has risen significantly, just like President Trump promised in his daily briefings. The increased testing has identified many more infected individuals with mild or no symptoms, driving down the overall proportion of patients who die from COVID-19. Infections are often identified earlier, which allows us to intervene earlier. Many treatments seem to work best when given well before people are at death's door. If you recall, that one negative study complaining about how hydroxychloroquine was ineffective was specifically about people on death's door. Well, no treatment was going to help those people. Now we are keeping life-saving equipment like ventilators in stock, precisely as President Trump promised. We have so many ventilators that he's exporting them to allies and to other trading partners. Look at this. We've had thousands of articles written in the last month about how wonderful remdesivir is. But here, the New York Times says it does not appear to have notable effects on mortality, just like the treatment that President Trump mentioned, hydroxychloroquine. No difference, but all the news media was telling us this was a wonder drug because it wasn't touted by this president. Younger people now make up a growing proportion of cases, and they are less likely to die from the disease. Wow, that's good news. Numerous states have been reopening their economies, which might be driving some of the youthful bias. Working-age employees have resumed jobs that cannot be done from home. Now, this is a negative if you believe that all of America needs to stay in lockdown until November 3rd so that we can elect Joe Biden. But if the political future of Joe Biden is not your primary consideration in life, maybe you would like to get back to work and get the economy going, right? Look at this. The message was felt strongly among the elderly. This despite the fact that PBS's Yamiche and CNN's Jim Acosta spent every daily press briefing not informing their viewers about how to stay safe, but engaging in pointless gotcha questions against President Trump. Notice that the news media didn't do this with President Obama, even though he had the same CDC team of Dr. Fauci and his staff working to solve the H1N1 swine flu. Why did the news media treat Obama's crises as a unified effort of a country working together, whereas everything was President Trump's fault with negative news? But with positive news, President Trump's name never appears in this story. I wonder why. Behaviors like mask wearing, physical distancing, and hygiene may be reducing the dose of the coronavirus, but so far, there is no evidence that this dynamic is contributing to the lower mortality rate in the United States. How about that? After month of reporters attacking President Trump for not wearing a mask, the New York Times admits that this dynamic has no evidence of contributing to the lower mortality rate. Now, of course, they have the typical news story where race, ethnicity, and social standing may increase your chances of contracting coronavirus. When the news media starts saying that women and minorities are hardest hit, you pretty much have solved the crisis. And here, look at this. They complain that physical and emotional distress is going to be the big problem, and death is not the only outcome. Translation: the crisis is over. When they start complaining about things other than death, We have licked this problem, America. Why would anyone find that a negative, unless your only goal is to attack President Trump? This final line here summarizes the entire story. Now that diagnostic testing is more widespread, that interval has widened. Thank you, President Trump, for working for the American people, and no thanks to the American news media for politicizing a nonpartisan virus